We're well aware of the health consequences of smoking, so it's surprising to think that so many people are still lighting up. Smoke-free laws are one strategy aimed at minimising smoking in public places to reduce the impact on our health. But do they have an effect? I spoke with Professor Richard Hurt at the Mayo Clinic in Rochester, Minnesota.
We studied the incidence of heart attacks and sudden cardiac death in Olmsted County people before and after the implementation of the smoke-free workplace law. The first law was smoke-free restaurants, and then in 2007 it was smoke-free workplaces, so all workplaces became smoke-free. We saw both a dramatic reduction in heart attacks and, for the first time, a reduction in sudden cardiac death. It was much bigger than we expected. We thought we'd probably see a 20 to 25% reduction maybe, but in our reduction in heart attack incidence was 45%, and the reduction in sudden cardiac death was 50%.
When you introduce these sorts of laws, it's likely that people who smoke less because it's harder, but also people who don't smoke are less subjected to secondhand or passive smoke. Do you have any idea which it is that you're seeing in this study?
We think it's the latter. We think it's the exposure to secondhand smoke, and there are several reasons for that. First of all, when we assess the percentage of smokers in both cohorts, before and after, the percentage of smokers was basically the same. So the prevalence of smoking was about the same, even though the prevalence of smoking had gone down in the overall population. The other things we were able to assess were, in the population, hypertension, high cholesterol, which are two risk factors for heart attacks, and both of those remained basically flat. Diabetes went up, obesity went up, so everything was either stayed the same or it got worse. And the only thing it did change was the exposure to secondhand smoke.
Because the tobacco industry and some others have suggested that the effect of secondhand smoke on our heart and blood vessels is overstated.
That's absolutely not true. In fact, it's probably an understated. You remember, the tobacco industry is known for creating doubt about health consequences without actually denying it. Those are their words. In fact, there's one document from Brown and Williamson about smoking and health. Doubt is our product. By creating doubt, we can create controversy. If we can create controversy, then we can delay things or get things derailed. So the tobacco companies have been instrumental in fooling the public about this for a long time. So for secondhand smoke, or tobacco smoke in general, it is a non-linear dose response.
What Professor Hurt means is that instead of the effects simply getting worse as exposure increases, what they find with tobacco is that even with very low exposure, the impact on our health can be just as dire.
Because the tobacco smoke has so many things in it, over 4,000 chemicals, over 60 known carcinogens, and the effects, the acute effects, are on the endothelium, the inner lining of the arteries, and on the platelets, as well as antioxidants, a whole bunch of other things. But the two main things are its effect on the endothelium and on platelets. So the platelets become sticky, they stick together, and that's what causes the thrombosis, coronary thrombosis, which is the beginning of a heart attack.
So what does the smoke actually do?
The effect on the endothelium, inner lining of the arteries, causes it to become more stiff, less distensible, so that when you have exposure to as little as 5 minutes of exposure to secondhand smoke causes the endothelial lining to become less distensible and therefore more rigid, which is not good, because when your blood pressure goes up when you have a pulse from your heart, and if that artery is not able to distend, then damage can occur to the inner lining of the artery. With 30 minutes of exposure, it reduces the coronary velocity reserve in your coronary arteries to that of a smoker. So 5 minutes of exposure causes endothelial dysfunction of the aorta, the main big blood vessel, and 30 minutes of exposure causes malfunction of the coronary arteries. So these effects are not only dramatic, they occur with lower levels of exposure.
So it's not just smokers who suffer the consequences. Passive smokers are affected too, quickly and at small doses. The question is, what can be done to protect non-smokers and to drive smoking rates down further, and especially to stop young people from taking it up in the first place?
Smoke-free workplaces are really important, as are taxes. Those two public policies do three things. They reduce consumption in people who continue to smoke. They smoke fewer cigarettes a day. Increases the chances of a smoker stopping smoking, and decrease the chances of your child or grandchild ever starting to smoke. That's why the tobacco companies fight those two laws so hard, is because it affects their bottom line. Another area that's of interest in helping people not to start smoking, young people, is taking smoking out of the movies. What we know about this is that the prevalence of smoking in movies is higher than the prevalence of smoking in the general population, and it influences young people to initiate smoking. So the graphic warnings, plain wrapping, getting them out of sight. Cigarettes are not something my great-grandparents had to contend with, because cigarettes were not a real product until the turn of the last century. The cigarette epidemic is really a 20th century phenomenon that's carrying over into the 21st century. So as we take them out of sight, take them out of movies, lower the smoking prevalence, then that returns us to the norm, which is when cigarettes did not exist. To do that could really influence the effect of tobacco smoke on millions of people.